Obesity rates have not improved for many years in Queensland, in Australia, and globally. It impacts 2 in 3 Queensland adults and 1 in 4 Queensland kids. It's costing the healthcare system over $750 million a year. There's no quick fix. It's an intractable problem with diverse causes, requiring complex solutions. Some of these span environmental, genetic, economic, and geographical. We need to act, and quickly. We need to nudge behaviours to support Queenslanders adopt and maintain a healthy lifestyle. Currently, less than 6% of children and 7% of adults are reaching daily recommendations for veg intake. Fewer than 48,000 children are getting their recommended 1 hour of physical exercise each day. Up to 45% of Queensland adults are experiencing poor sleep health. It's important to understand why. Health and Wellbeing Queensland is working hard to drive generational change through a strong focus on equity, obesity prevention, food security, and clinical prevention, working towards better health for all Queenslanders. We're working relentlessly with partners, the community, the system, and individuals, connecting in an impactful way to create change for everyone. Prevention is the key. Its efficacy is undisputed. Now is the right time and for the right purpose. There couldn't be a better time to reset, reframe, and refocus on our health and the prevention of chronic disease. Generation Queensland is the vision. Health and Wellbeing Queensland is the driver. Together, we will lead change that benefits all Queenslanders.
Make healthy happen!
Well, good morning. What a beautiful day, and welcome to the Queensland Prevention Symposium 2024, brought to you by Health and Wellbeing Queensland in partnership with Queensland Health. Welcome to everyone here in the heart of Brisbane, but also a big welcome to all those viewing us online across Australia. My name is Madonna King. I'm a journalist and an author, but my job as MC is to make sure you get everything you can out of your symposium. If I can assist in any way, please just tap me on the shoulder. Before we get underway, can I ask that you just ensure your phones are on silent? The bathrooms are located in the foyer, and in the unlikely event of an emergency, we would just follow closely the instructions given to us by staff. And with that out of the way, please join me in welcoming Tim White with our Welcome to Country.
Good morning, how are we this evening? My name is Tim White. I'm representing the Yagara and Turrbal people today to give you a welcome to country. See, a welcome to country is not to welcome you here to Australia. It's to welcome you to the land that we gather upon today to conduct our ceremonies and our family traditions. A welcome to country is something that's not made up like just overnight from a couple of elders sitting around by the fire, or event organisers, or a couple of good-looking black fellas like myself down at the local, just to get TikTok famous. It was created many years ago from different tribes if they wanted to go into neighbouring areas. If we got a little thing called a message stick. See, if you didn't have this message stick, you can go into neighbouring tribes. On that message stick, it had markings and carvings to determine why you were coming into our country. If you didn't have this, you'd be speared on the spot and told to go back to where you come from, or you'd be that severely injured, you'd lay there and die. Thank God they made mobile phones and Facebook these days. We can contact people a lot easier. In our country, for the Yagara people, we'd like to do a blessing song, which we call Malacha, to welcome you in a good spirit, to make sure you have a safe and peaceful journey through our country and return back to your loved ones in a safe and peaceful manner. This song here is Malacha, to welcome you in a good spirit. Yo nani Yagara nuru, yo nani Yagara Malacha, yo hey. Danare Yagara Malachana, Malacha Yagare Danare, Amiojana Malaranga Noro, Miojana Malaranga Noro, Danare Yagara Malacha, Malacha Yagare Dandare, hop. Danare Yagara Malachana, Malacha Yagare Dandare, Amiojana Malaranga Noro, Miojana Malaranga Noro, Danare Yagara Malacha, Malacha Yagare Dandare, hop. Danare Yagara Malachana, Malacha Yagare Dandare, Amiojana Malaranga Noro, Miojana Malaranga Noro, yo. Welcome. It's okay to clap. On behalf of myself, Tribal Experience, and the Yagara Turrbal people, I'd like to say welcome, Nanya Numbly, and thank you. It's been a wonderful audience.
And thanks again to Tim White for that welcome to country. And now for our first speaker, I'd like to welcome Professor Frank Tracy to the lectern. Frank has 4 decades of experience working in health systems, including executive roles in big health organisations and the non-government sector. He has a clinical background in nursing, holds advanced qualifications in health management and governance, and boasts strong executive management and leadership skills. He has an applied interest in population health policy, planning, and translational health research. And whether it is in government or non-government roles, he delivers sustainable health strategies that serve the best interests of consumers, health professionals, the broader health system, and the community. Professor Tracy, welcome.
Thank you, Madonna. What a wonderful introduction. I'd love to meet the person who wrote that. Thank you for that beautiful welcome to country. And most importantly, I too would like to acknowledge the lands on which we're meeting today. For those online, that's with Yagara and Turrbal peoples' good grace. I want to acknowledge elders past, present, and those who are emerging, but also to anyone in the room who's got Aboriginal or Torres Strait Islander heritage. Welcome and thank you for being involved in this conversation. I've got big shoes to fill this morning. I'm here on behalf of our Director General, Michael Walsh, who sends his apologies and who really did want to be here today. He's such a champion of prevention and early intervention, and on building a legacy that will create a healthy and happy Queensland. Michael did warn me that this could be a career-limiting step for me as I opened the symposium. So I'm asking for your good grace as I work through some of Michael's speech notes. As the Chief Executive of Children's Health Queensland, I couldn't be more proud of the focus that we have on health and well-being and children and young people in this state, because I'm the person that gets to see that in action each and every day. And I know I'm joined in that by many of you in this room, and I wanted to acknowledge early Professor Robin Littlewood, the Chief Executive of Health and Wellbeing Queensland, and her chair, Steve. I also wanted to acknowledge Luke Twyford, our Children and Family Commissioner. But there are many others in the room who choose to be here. And with that in mind, what I wanted to ask you to do for 30 seconds, and I promise I will keep time. I'll keep time for 30 seconds. But I want you to think about the circumstances and the people in your life who have allowed you to be as healthy and happy as you are and your families are, who have been the architects of creating an environment where you have been able to thrive and you have been able to be on that journey to fulfill your full potential. So can we take 30 seconds to do that? Please reflect. I'll keep time. Thank you. I'll bet when you were going through that particular journey, there were many people who popped up in your life. But there are many who've gone before them. There are many people who've been the architects of our community, our society, our health system, our social housing system, all of the things that create a happy and healthy community. I'd also invite you to look around the room today, and I'll get back to this later on. to think about the opportunity that you have in your hands right now to create an even happier and healthy future for so many more. So when this event rolls around next time, there'll be younger people in these seats. You'll be here, you'll be mentoring, you'll be guiding, you will be pushing that dial for a better, happier, and healthier community. I wanted to point out some things that are important to us from a Queensland health perspective. So at a systems level, our government strategies like putting Queensland kids first and the first 2,000 days are just two examples of how we are investing in our future. Our government have made a commitment to health, a record commitment, a record spend, and thankfully it's not all in the dis-ease end. There's much more of an awareness now of bringing us back up that continuum to think about those very early years and those opportunities that exist in communities. A recognition more and more that communities are an oasis of resources. And if we can harness that through co-design and partnership, anything's possible. And I truly believe that. So I'm feeling very optimistic about the opportunity and how our wider ecosystem of policy, promotion, prevention, advocacy, and care is beginning to align across government and across our care, housing, education, and social system. That's only possible because people like you are doing the heavy lifting. You are doing the heavy lifting. The policy work, the framework, the strategy, the intent. You are the architects and you are shaping our future. So welcome to the Queensland Prevention Symposium. I've been talking with Robin about this symposium for what feels like 4 years. And here we are. And just look around the room and think about the opportunity that gathering together as this village of prevention-focused people and early interventionists, the opportunity that that provides us. You are leading by example. Because this event, it recognizes the incredible capability, passion, and commitment of you who are working tirelessly for the entire state in the area of prevention. And why are you doing that? Bring you back to the 30 seconds you spent earlier. Because you know it's the right thing to do. You know that if you don't do it, who else will? And you know that you're in this place right now to make a significant contribution to the health and well-being of every single Queenslander. So a huge thank you and recognition to a range of people within our hospital and healthcare system, primary health networks, general practitioners, nurses, doctors, allied health. I think I've bumped into a few people this morning who are card-carrying members of all of those groups. But to community leaders, to volunteers, to those who work in our councils, our council workers, people who work in retail, people who work the land, who grow our wool and beef, our food, our vegetables, our fruit, our rural and remote communities. Thank you. Thank you to our First Nations communities and our culturally and linguistically diverse communities. And importantly, thank you and recognition for all the mums and dads and grandparents and leaders in communities who make a difference in the lives of their families every day. Who doesn't want the best for their family? I don't think I've met anyone in my life who didn't want that, who didn't aspire to that for their children. So whether you're policymakers, you're practitioners, advocates, stakeholders, consumers, educators, or community leaders, I can guarantee you that the sessions ahead will interest you. Be curious about what the presenters today bring to you. Think about how you can weave that into your leadership journey, into your architecture, into your doing, into your building. It is that important. It's really important. Robin reminded me this morning how important it was to just focus on the small things that make a big difference. Those small steps that we take in our everyday. Physical activity, nutrition, and now more than ever, psychological well-being or mental health, depending on where you sit on that continuum. It's a real challenge for our communities. It's a real challenge for children and young people. And some of the statistics are frightening. We should be cautious. We should be alarmed. But the relentless optimist in me tells me that we will adapt. And we will use a strengths-based narrative to drive the change that we need, and to harness the intellect, to harness the solutions and the innovation that exists within us. Remembering that our communities and communities like this are oases of resources. I wanted to remind you, and this is close to my heart, that we have a duty of care for the next generation. So in our architecture, in our building, in our doing, in our leadership, we have that duty of care to those who come behind us. And it was interesting, recently I was on a flight interstate, and there was a gentleman who came into the bathroom. I was using the bathroom, and a gentleman came in, and he pulled several paper towels out of the machine and mopped down the bench after he'd finished washing his hands, and cleaned the taps and popped the paper into the bin. And I casually, when I was going out, I said, "Well, thank you for doing that." And he said, "Yeah, it's not difficult to leave everything a little bit better than you found it." I thought that was quite a remarkable thing to see in an airport toilet. So if you can have that kind of a mentality in your life, imagine what you can do. Imagine what you can do if you just left everything that you touched a little better for those that are coming next. It might just change things. It might just be the catalyst that moves us forward. No small thing is too small. Small things make a big difference. I did want to mention some of the barriers that exist in accessing health systems and health care and good education. I did want to talk about that a little bit more, but there are experts in the room today that will talk about that. I wanted to remind you that, and invite you to take a strengths-based approach to this. Our deficit language, to my mind, and I'm getting on a little bit, but I'm in a lot of fora, and a lot of meetings, where I'm seeing the problem polished, and repolished, and restated, and refocused, and strategized, and planned, and evidence-based. And I'm thinking genuinely, when will someone pop their hand up and talk about what it is we're doing? Can I ask you to think about being that awkward person in the room who pops their hands up and says, well, the evidence is in, we know that, let's not get great, let's not let great stand in the way of good. What might we do now that would change the trajectory and develop the momentum that we need to make a real difference? And I'm looking at each of you. I can see you through the lights, even though it's bright. I'm looking at you in your eyes, and I'm inviting you to take that challenge on. Be that person, so the next time I'm in a meeting with you, I know I've got an ally. I won't always be that person that's saying, hey, maybe, and people go, but there are barriers in the way. So let's remove those barriers for Generation Q. The children and young people who are now coming up and growing and moving into this next generation of leaders. A couple of quick things as I progress. There have been two, I think, and I'm a little bit biased, I think there have been two great things that have happened over the past decade in Queensland Health. One, of course, has been the establishment of Health and Wellbeing Queensland, the very first of our state's dedicated prevention agency. So can I ask you to give a round of applause to Health and Wellbeing Queensland, who are celebrating 5 years. And through their energetic and fit chief executive, Robin Littlewood, they've achieved quite a bit. And I'm going to tell you about some of these things right now. But before I do, I want you to remember that Robin has a long history of getting things done. And I can tell you she doesn't intend to change that lifelong habit. So our leadership in Queensland in prevention is in very good hands. And remember when I talked to you about that action bias? Yeah, I need to say no more. So since she became the chief executive, they've launched two major government commitments: Making Healthy Happen and Gather and Grow. And they've delivered 63 actions across 19 agencies. And they'll do that. There's a year left on that by 2026. So that's a big work plan. But some of the things that they've done include Pick Up the Crop, which has now reached over 200 schools and more than 45,000 students across the state. Pod Squad, again, something close to my heart, an online, gamified health and well-being app for children, young people, and parents and carers. Now, please don't reach for your phones immediately, but I'm encouraging you to pop online, go to the App Store, look at the Pod Squad app, download it. Your nieces and nephews, grandchildren, children, they'll be delighted with you. It's a fantastic product, and what it has done is reached over 16,000 children and families. That's quite amazing, and it's still in its very early stages. That piece of work was done in partnership with the University of Queensland and Health and Wellbeing Queensland. Through Health and Wellbeing Queensland and our government, there's been over 89 million invested in prevention programs, reaching over 120,000 Queenslanders. Remember, I mentioned at the beginning that this was an indication of government's investment. I could not leave this podium without mentioning the second milestone, which is the 10th birthday of the Queensland Children's Hospital. And we are so proud of having reached that decade, that milestone. We had a recent 10th birthday celebration for our volunteers with our foundation. Remember that notion of it takes a village to raise a child? Well, the village got together and we had a 10th birthday party. There was lots of knee sliding to disco music. There was cake, fairy bread, Fanta, chippies, lots of stuff. But it was a fantastic event. We're celebrating more later on this year, so you may want to join us on the 29th of November at the Queensland Children's Hospital. But I did want to shout out to the amazing staff of our hospital and health service. Because for us, prevention, intervention, and care doesn't start and stop at the hospital door. But every day we see over 220 kids and young people in our ED department and 1,000 outpatient appointments at the Queensland Children's Hospital. We also see up to 1,500 appointments right across our community-based services and others across the state. And we're present in schools, in kindergartens, in community centres, where people are, I want us to be. So to the cleaners, the wardies, the admin staff, the doctors, the nurses, the allied health, the team CHQ of over 5,000 people that make that beautiful institution work, thank you. Thank you for what you do every single day. In that work, we partner with Health and Wellbeing Queensland, and we continue to do that on some very interesting pieces of work. Much too many to go into detail here, but I wanted to give Robin, Steve, and the team our commitment to continue that work. Partnerships and collaboration is how we need to work to harness the energy and the commitment that each and every one brings to the table. But can I tell you, in my career, it is the hardest thing to do. Everything else is really easy. Partnering is hard. It's hard work. But please, please, don't give up. And again, think about when you're partnering in life. Some of us make terrible choices. And some of us are very lucky. We fall in love, and we make fabulous lifelong choices. And we grow, and it deepens. The trust deepens, and we do great things together, like have children and bring them up to be beautiful adults. So partnering is a really important thing to take seriously. It can have a lifelong impact and fundamentally alter our world. There are a few other things that Robin would absolutely kill me for not mentioning. And one of them is the Olympics and the Paralympics in 2032. Seems a long way away. It's 8 years. That is a blip. So we need to be preparing now. We need to take advantage of that opportunity to be on the world stage, to have Queensland and this little town, Brisbane, really on the map. We've done it through a lot of other endeavours. We've done it before. The gold medal tally is not something that we're going to be focused on, but we will really be in the background. But what we want to do is that we want to create that infrastructure, that legacy, that opportunity that actually gives the world a glimpse into what great looks like. What a great community, what a great society, what a kind society, what a thriving society looks like. That is the aim. And I know that Robin and the team who are leading the work in the prevention space around the 2032 Olympics and Paralympics, they've already started that work and are deep in it. I just had a thought about the sponsorship challenges that may cause. So given this notion of obesity, sugar, and the various other items that are brought to the table by a myriad of sponsors, I would give anything to be in the room for some of those contract negotiations as we get on to the dietetics and the prevention agenda. But genuinely, I think it is really important, and it will make a substantial difference and leave a lasting legacy. A couple of final things. There's a newly established partnership between Health and Wellbeing Queensland and the University of Queensland. It's the Health and Wellbeing Centre for Research and Innovation. That partnership brings prevention research and government policy closer together to effect an evidence-based and focused approach to improve the health and well-being of our population. And remember earlier I mentioned the evidence-based work. That is so critical, I know, in the work that each and every one of you do every day. We need the proof points, we need the evidence, and we need to learn from our mistakes. There's much more that I could talk about, but I really did want to wrap up by giving a shout out to one of our communities in Bundaberg who are involved in a co-design initiative with Health and Wellbeing Queensland. It's called Do Your Thing, and I couldn't think of a better title for a community-based initiative where a community gets together and again taps in to that oasis of resources that I mentioned earlier. So it brings together councils, non-government organizations, community groups to respond to local needs. It's not a new phenomena, but I wanted to mention it specifically because we're doing it and we're living it and we're shaping it in regional and rural Queensland. I mentioned the games, and I wanted to remind you again that they have the power to inspire and the power to shift, not only in sporting prowess, but I remind you right now at the Queensland Children's Hospital and in schools right across our state, there are gold, silver, and bronze medalists sitting in treatment chairs, in beds, in schools, in school assemblies. Some of those gold, silver, and bronze athletes and Paralympians do not have the opportunities that some of their peers have for a variety of reasons. Think about how we can change that environment to give them that very best opportunity. So in closing, let's see what this next 8 years can bring. How can we leverage what it is that we're doing? How can we create a living legacy that starts now? I want to encourage each and every one of you to engage fully in the sessions ahead and share your experiences, learn from each other and be inspired. Because I know that together we can create a healthier and happier Queensland. So on behalf of our Director General, thank you to Health and Wellbeing Queensland for putting this amazing event on, and to our colleagues in the Department of Health for partnering to make this happen. You're here because people imagined this and created this through their hard work. Finally, and back to the beginning, I want you to spend a moment, and I'm watching you, I want you to spend a moment looking around this room. Have a look around this room. Look at the people behind you, beside you, and in front of you. This is what opportunity looks and feels like. This is it. This is what opportunity looks like. Grasp it. Make those connections that matter. Commit to action through partnership. Be the change that our communities need now more than ever. And importantly, architect, build, and create a legacy for every Queenslander, the one that they deserve. Thank you, and enjoy your day.